With states like California moving to an endemic policy for COVID-19, we're talking with health officials about when we could see an official shift here. 2 News reporter Allison Gens is here in the studio with what it takes to move the pandemic to an endemic. Allison.
John, health officials say there's really no unified determination that makes a disease endemic, but there are a few factors that can indicate it's reached that stage. An endemic means a disease is always around but limited to a certain region or sees a consistent yearly spike like the flu.
We use that term endemic because we think kind of like that's the end of a much larger pandemic. But truly, I think it's really hard to pinpoint and say what is going to be endemic versus pandemic.
One measure that can help make that decision is predictability.
You compare it to something like the flu, which is endemic, you have a curve that's similar each year. And whereas right now, the stage we're at in COVID, it's still showing very wide swings in terms of how predictable it can be.
Health officials say they're watching hospitalizations, deaths, and long-term case trends.
Over a longer period of time, we can determine exactly what those baseline levels are. Right now, we don't have an overall baseline level of what a normal, if you will, amount of COVID is.
What we're really looking for at the end of the day is those cases per 100,000. That's what we've always leaned on. We want to see those get down under 100.
And health officials say when something is an endemic, it does not mean it's not a danger to people's health, making immunity another endemic factor and vaccinations a key to getting there.
I do feel strongly that vaccination is the way for us to get out of this pandemic situation.
And today was the last day for the National Guard at Miami Valley Hospital, and why health officials are cautiously optimistic about that coming up on 5 on 2. In the studio, Allison Gens, 2 News, working for you.